UST. Currently, she's connected with the primary care physician Pelham Medical Group and attending an MD at St. John's Medical Health, St. Joseph's Medical Health Center. She also is a clinical preceptor for residency programs, and she has a very active and growing aesthetic practice. That she has like tons of certifications. I'm only naming a few of them here right now. Certified on advanced techniques, combined use of Botox, dermal fillers, and facial enhancement. Certified Obagi system. Certified on weight management and medical fitness for primary care. Certified on cosmetic laser procedure. Certification on mesotherapy, submental liposuction. And of course, the basic ACLS, BLS, and PALS. She had presented various topics and research projects, mostly on geriatrics and on these topics. It's with great honor that I introduce you our next speaker, Dr. Alicia Santamaria Almendral. Just a quick reminder, we would also like to ask everybody to turn off their cell phone at this point.
Thank you, Ian. He was my classmate during our nursing days, and he's very active even before. So thank you for that introduction. I'll be talking about medical aesthetics, mainly non-surgical procedures. I'm not a surgeon, but I specialize in aesthetic medicine as well. So the title of the talk is Quick Time to Turn Back the Clock. So disclaimer, the materials that I used here in this talk are mainly for educational purposes, so whatever liabilities that may happen to you, going through the same procedures, I'm not liable to that. But maybe I'm just here to give my opinions, general guidelines. Might not be the best procedure, by the way. So, the scope and limitations of this talk are the following. I'll talk about the different factors affecting skin aging, what the latest trends are in non-surgical cosmetic procedures, what are the most common non-surgical cosmetic procedures used to treat age-related facial changes, discuss each procedure briefly and its uses, who are the best candidates, safety, downtime, associated pain, the average physician fees. You would know that. You would want to know that. Immediate and versus delayed results, duration of the effects, maintenance, and maybe shift a little bit towards the end of my talk about this controversial medical weight loss HCG diet, which also leads to youthful appearance. So as you can see, this is a picture of an elderly woman who seems to be happy smoking, but I don't promote smoking because of the ill effects to your skin. But anyway, as extrinsic signs of aging, you can see lines, deep lines, folds, wrinkles, looseness of the skin, sagginess of the skin. So those are all associated with aging. So first of all, let's talk about the factors that affects aging. I divided it into extrinsic and intrinsic aging. So let me just start with intrinsic aging. This is the natural aging process, and it's a continuous process that usually begins in our mid-20s. So chronological aging is influenced by genes. So look at your parents. It's also by race and gender. So cell renewal slows with age. The collagen production tends to slows down as we age. And there's a substance that's responsible for snapping back the skin to its normal state, which is called elastin. And as we age, the production slows down too. And the dead skin cells do not shed as quickly as we get older. And the ability of the skin to snap back decreases. So hence, it produces looseness of the skin, fine wrinkles, deep lines. Now, the signs of intrinsic aging usually becomes typically visible after a few decades. So these are the fine lines on your face, fine wrinkles, thin and transparent skin. There's also loss of underlying fat, leading to hollow cheeks and eye sockets. And also, there's noticeable loss of firmness on your neck and hands. So also the bone shrinks away from the skin due to bone loss, so it causes sagging skin. Also dry skin can cause itchiness and insufficient sweating. To cool down the skin is decreased. There's also graying of hair that eventually leads to white hair. There's loss of hair, but there's also appearance of unwanted hair. What else? The nail plate, it thins out, and the half moon disappears, and ridges start to develop. So those are inevitable changes. Okay. Alright, sorry. Now let's go to the other side, extrinsic aging. There's several factors that act together with the natural aging process, and this leads to premature aging. So this can be, I guess, can be modified, or we can do something to delay the extrinsic aging. So daily environmental and lifestyle insults from pollution, stress, smoking, etc. Facial expressions. How many of you do facial exercises? Because, it promotes circulation, leading to youthful face. Remember they say promote circulation? Okay, it's time to stop. It's time to stop doing all those facial exercises, because repetitive muscle contractions can lead to fine lines and wrinkles. Okay. So
smiling and laughter.
As I said, repetitive facial expressions. The reason why is when a facial muscle is contracted, it forms groove, underneath the surface of the skin, and this forms line with each facial expression. If you continue to, if you repetitively using your muscles, eventually as we age, the elasticity of the skin changes too. So as we, in our 50s, the elastin substance production is decreased. So now it forms what? Permanent lines etched on your face, which leads to deep wrinkles and deep lines. Smoking can cause biochemical changes that accelerate aging. And research shows that in a person who smokes at least 10 cigarettes per day for at least 10 years is statistically most likely to produce deep, very deep lines and leathery skin. And in 2002, there's a research that was conducted showing facial wrinkling, which may not be visible to your eye right now, but under the microscope, you see changes already as early as age 20 in smokers. Not only that, it also causes yellowish hue on your complexion. So smoking is bad.
Yes.
For your skin. Gravity. So gravity constantly pulls on our bodies. So as we age, again, the elasticity becomes less effective on our skin. Let's bring it back to the normal state. So, what are the effects of gravity to our face? The tip of your nose droops. You know, your upper eyelid skin goes down. Your ear, the ear elongates. What else? You form laugh lines because of the gravitational pull to the cheeks. And also jowls are formed also. The jowls are the ones that you see on the jaw area. So what else? Your upper lip disappears too, while your lower lip becomes prominent. So those are effects of gravity. Another factor is, have you heard about sleep lines? So sleeping position, you know, as when we sleep on the same position over the years, it actually, you know, we form lines also. Among women, we tend to sleep on our sides, so expect lines on your cheeks and chins. While men, usually they develop forehead lines because they tend to sleep on with their face pressed on the pillow. While those who sleep on their back, of course, have less wrinkling. So try to change your sleeping habits. Okay, ultraviolet rays from the sun. They cause free radicals to form, which cause damage on the collagen synthesis of cell renewal and elastin. If you're repetitively exposed to sun, so it impairs the repair of damaged skin. Age spots, freckles, blotchy complexions, actinic keratosis. So those are white-like, rough surfaced patches on the skin, on exposed areas. Those are photoaging signs. So it really depends also on the skin color. So photoaging, the amount of photoaging is dependent on your skin color, on the intensity of sun exposure, and duration of sun exposure. And people with fair skin usually has more extrinsic signs of aging. And just like what I mentioned, those age spots, AKs, or actinic keratosis. While people with dark skin, usually they have fine lines and mottled complexion, not more of AKs. So very important to always wear sunscreen. So if you notice when you're buying sunscreen, there's the sun protection factor, 30, 45, 50, 60. I would recommend using at least 30. And remember to apply your sunscreen 20 minutes before sun exposure. It's not effective right away. It takes time. And make sure, for example, so if you're using SPF 30, you have to reapply in 2 hours. If you're using SPF 50, you reapply in 4 hours. So it's really more of the duration of the effect of the for sun protection. Dehydration, of course, is with dehydration, it occurs when your skin moisture is lost. We usually lose about half a pint of water every day, so you need to replenish that. So what are the signs of dehydration? Wrinkling, dry skin, flushed. So those are the signs of dehydration. What are the causes? Sun exposure, prolonged sun exposure, exposure to extreme temperature, very hot, very cold. Air conditioning can also cause dryness of the skin. Harsh soaps, poor hygiene.